Welcome to the documentary showcasing the remarkable story of change in Adamawa State, Nigeria. Over the years, the Adamawa State Primary Healthcare Development Agency has been at the forefront of continuous quality improvement, transforming the healthcare landscape and improving the lives of its citizens. Adamawa State Primary Healthcare Development Agency has made significant strides in enhancing service delivery, investing in crucial resources and infrastructure. This includes the provision of more equipment, drugs, mama kits, and essential medical supplies, ensuring that healthcare facilities are well equipped to meet the demands of the population. Additionally, extensive training and skills upgrade have been provided to healthcare professionals, ensuring a competent and capacitated workforce. The executive chairman of the agency speaks.
Indeed, the coming of the administration of Governor Umaru Fintri in Adamawa State has really revolutionized the delivery of primary healthcare services in all its ramifications. In terms of governance, we have a fully constituted board and management with effective leadership that has attracted a lot of partners from across the country and across the globe. In terms of human resource, we've been able to recruit severally. Today, 25% of the health workforce of Adamawa State were recruited within the last 2 years. More still, in terms of financings, we've been able to improve our total expenditure, budgetary performance, including the consistent payment of all counterpart funding on the part of the Adamawa State government with respect to all our projects and primary healthcare service delivery. In terms of information, we have rejigged the use of data for informed decision making, which has really translated into remarkable success. Today, in the entirety of Northeast Nigeria and even Northern Nigeria, Adamawa State is doing wonderfully well in terms of service delivery, uptake, and utilization. Furthermore, in terms of logistics, drugs, and commodities, this administration has supported us in trying to establish an essential drug and logistics department, which we never had. Beyond that, it has improved the functionality of that department through the reinvigoration of drug revolving scheme, which has increased access to affordable, quality, assured drugs through the various primary healthcare facilities in the state. And for still also, we have tried to look at entirety of the relationship between the primary healthcare level and the secondary level. Some LGS never had a secondary facility, but Governor Umaru Fintri's administration has established secondary health facilities where none exist. In some places, we have even 2. So now what we are doing now here is it has improved the referral services, cases. All cases referred from the primary to the secondary level have assurance that they will go there, and when they get there, they get the needed quality care. Indeed, these are some of the great achievements. To us in the primary healthcare space, we've never had it so good until the coming of the administration of Governor Umaru Fintri.
The implementation of Social Health Insurance Scheme by the Adamawa State Contributory Health Management Agency, ACHMA, has revolutionized healthcare access in the state. These schemes have reduced financial barriers, enabling more individuals to afford the medical services they need. As a result, access to quality healthcare has significantly improved, leading to better health outcomes for the population. Dr. Amos Ujulu sheds more light on this.
For the first time on both sides of the healthcare system, the demand side and the supply side. Supply side has to do with preparedness of the primary healthcare system to render quality healthcare services. And on the demand side, internally displaced persons have been enrolled. This is a product of extensive engagement and a very robust collaboration that is evidence-based. It has been a rewarding experience, and a good number of IDPs have been enrolled under the health insurance scheme. Specifically, about 14,000 IDPs have been sponsored through the Heron project to be able to access healthcare services in Adamawa State. It promotes inclusion of the vulnerable, disenfranchised in terms of their livelihood, so that made them vulnerable. So that intervention has helped to restore their human dignity and also gave them a sense of belonging. As a matter of fact, that intervention is catalytic in the sense that it was based on agreement that it was based on one-to-one agreement or matching basis. Specifically in the context of the Heron project, where 14,000 that into monetary terms, that translates into about 200 million naira has been paid by IRC. And then, of course, the equivalent of it also is another 200 million that the Adamawa state government also has provided to enroll another 14,000. So if you put the math together, we have over 400 million naira that has been invested specifically to cater for the health needs. And this is, like I said, part of improving coverage to be able to cover vulnerable population. And beyond that, it has improved the fiscal space in the state in terms of health investment in Adamawa. And for the sake of our listeners, this is a challenge fund and a pioneer project that is being done in Adamawa State.
To ease the burden of referrals and bring healthcare closer to communities, the state government, under the able leadership by Governor Ahmadu Umaru Fintri, has constructed new cottage hospitals, complemented by an enabling environment in existing general hospitals. This infrastructure development has made healthcare more accessible, ensuring that individuals receive the care they require without having to travel long distances. The Honorable Commissioner, Chief Felix Tangwame, speaks holistically on health systems.
We have had tremendous achievements in the area of infrastructural rehabilitation, purchase of equipments, quick response to epidemics and dreadful outbreaks. He has also done very well in the area of building new facilities in Adamawa State. He has done very well in ensuring that our primary healthcare centers are uplifted to a grade that can have people come to access healthcare easily in their rural areas. There are a lot of rehabilitations going on. New cottage hospitals have come in, equipped, commissioned. Counterpart fundings are promptly paid. A lot of students are also on scholarships, those studying in various universities across the country. And His Excellency had intervention in the agencies where there were no interventions in the past. But while I came on board and I look at what was happening, we've had supplies of mattresses, we have supplies of equipment. You go to some of these theaters, you will see equipments and you will be happy that the staff have what they need to work with. So it has been wonderful.
The Adamawa State Primary Healthcare Development Agency has adopted an integrated approach to health system strengthening through enhanced supportive supervision of service delivery. This comprehensive approach has not only increased the output and efficiency of healthcare services, but also resulted in improved health outcomes at the population level. How true is the state healthcare in the respective local government in the state? The executive secretaries of the primary healthcare authorities speak more on the thriving community-based activities.
Initially, if you look at our baseline data, in the past, we have improved tremendously in data and also in quality of care. So with the support that we are getting from the government and other donors or partners, we have improved. Through the government, we are being supported from the Impact Project and Basic Healthcare Provisional Fund, and also the NHIS through ASHMA, Adamawa State Contributory Health Management Agency, where our enrollees redeem their services in primary healthcare sector. Looking at our indicators, like in ANC services, in the baseline, we are at 45%, but now we are at 90% in our ANC coverage. In immunization coverage, initially in the baseline, we are recording 45 to 47%, but now we are almost 89 to 90%, and also other indicators similar to that. So thank you very much for this wonderful support, and also looking at the other challenges is now primary healthcare is being revived.
Yes, thank you very much. There is a good improvement in terms of key indicators in primary healthcare settings in Michika, especially in family planning, ANC, labor and delivery, OPD, fully immunized children, and malaria has in fact, there is a good improvement. Before then, it was 55%, but with the coming of the government on board, because how the communities are patronizing the communities, because of the government have just have the facilities, also equip the facilities, and also staff almost all of the facilities. The community have just started patronizing the facility, and because of that, OPD, look at OPD now. OPD has just been rising from 60% to 100%. Family planning, before it was 45, around 45, 46, but now almost 98% with this regime. Look at this labor and delivery. On a facilities before, women are not patronizing women are not patronizing it, because when they come, there is no equipment, there is no manpower, so they normally deliver at home. But they come out the present government infrastructures have been done very well for them, which looks so conducive to them when they come in. And there is a good stuff, that technical stuff, that at least when they come, they appreciate and they welcome them. And secondly is that because of that, again, there is the good equipment that normally we refer patient to general hospital because of lack of equipment. But they're coming on the board of the governor. Now all equipment is so staffed that before labor was around 40, 35 to 50, whatever it is, but now it's almost 100%.
Many changes have been recorded in infrastructure. For example, you can see that places like the Ubele have built a new delivery room. You can find new consultation rooms in certain facilities. You will find new ANC sheds in certain facilities like Alcala and the rest. We have also seen a rapid development in the number of ANC attendants, especially ANC 8, which has been just introduced, as well as delivery in terms of numbers. If you go to Nigeria, for example, in January, the delivery was 1 something. In February, it was 2. In March, it was 2 something. So that is a clear indication that there was improvement. If you come to places like Yerba, you will find that they have renovated their borehole. So generally, the impact has been a success in terms of quality of care, in terms of renovations, in terms of allowing people to access care, and the feedback we receive from the communities has shown that now is better than before.
Beyond healthcare facilities, Adamawa State Primary Healthcare Development Agency has expanded its community-based activities such as surveillance, community-based care, school health programs, outbreak response initiatives, and vaccination campaigns. These efforts have positioned Adamawa State as a trailblazer in community-based prevention and response, successfully averting outbreaks of diseases like cholera, diphtheria, Lassa fever, and meningitis. Stakeholders and traditional leaders, respectively, attest to the impact of healthcare service delivery in the state.
Ko gaskiya batun asibiti babban abu ne ga mutanen gari. In ba asibiti ba zaman lafiya. Kuma gaskiya asibiti da muke da shi, more especially a Nawa, da mata ba sa zuwa awo, yanzu kuma mata suna zuwa awo. Da ba sa zuwa haifuwa a asibiti sai a gida, yanzu suna haifuwa a asibiti. Ana samu 5, 10 a rana ma, wata rana. Don haka ba abin da za mu cewa gwamnati, mun gode musu, Allah ya saka musu da alheri. Gaskiya asibiti mu yanzu akwai gadaje, da ba gado, amma yanzu akwai gadaje. An gera gadaje, ana haifuwa a wurin, akwai machines, akwai abun awo, kome da kome akwai. Hatta ma kwanan nan an samu magunguna har da an buga store, na je na gani da kaina. Don haka mu asibiti tana da amfani a wurin mu sosai, kuma muna godewa gwamnatin Alhaji Ahmadu Fintiri akan ayyukan da ake mana. Gaskiya muna jin daɗi, Allah ya saka mishi da alheri.
Muna participating a cikin duk wasu abubuwan da ake game da health a nan tun ina mai jimilla. A gaskiya akwai improvement, more especially yanzu hakan na a cikin mulkin gwamnan Fintiri. Ahmadu Fintiri da gaskiya ya yi kokari, ba karamin kokari ba akan health. Don mun ga abubuwan da yi dewa da yake kamar ni duk wasu programs da ake yi ina participating tun ina mai jimilla Europatogin nan, health na Europatogin nan, duk wasu abubuwan da ake harani da kaina ina fita su vaccine, wasu abubuwan nan da ake duka ina fita ina bin mutane, muna yawo muna yin ayyukan health. A gaskiya akwai improvement, ya fi shekarun da suka wuce baya. Zan fara da abubuwan da suka wuce kamar polio nan yana nan, ba za ka iya gida ɗaya biyu za ka sami polio nan da, amma yanzu ya zama polio sai dai mu ji labari ɗaya ya ɓata. Cututtuka da yawa irin su measles, akwai abubuwa da yawa, cututtuka da yawa wanda suka ɓata. Yanzu dai abubuwan da yake dan cewa mutane dama a Korea, malaria da yake bayan nan. Although malaria ma yanzu ya dan yi baya, ba kamar na daɗin ba, gaskiya ana kokari. Yanzu satin da ya wuce nan muka gama wasu program na polio. Ni ma na bi su, mun bi unguwa gidaje mun je mun yi vaccine. Kun gama, a gaskiya akwai improvement.
The remarkable achievements of the Adamawa State health sector have not gone unnoticed. The state has attracted global recognition, including partnerships with organizations like USAID and Japan's International Organization for Migration, IOM. These collaborations further endorse the effectiveness and impact of health programs implemented in the state. These and many more, as facility manager, gives highlight on the tremendous improvement in quality of healthcare service delivery in the state.
The facility before was just none, because even paracetamol I don't think we have in this facility. But with N-ship, that is where the facilities start growing. We grow in so many service delivery. Before it's only immunization and just peripheral care we used to give here. And gradually the facility is still growing. What led to this, our success, is for the support we have from our WDCs, our LGA, because without their support we cannot do all this. Because when we come with a plan, we sit down together and they see what we want to do and encourage us to do it. So with this encouragement, it really supports us to carry out all our plans. That is.
We really thank God for His Excellency Honorable Amadou Umaru Fintiri. We can see clearly the dividends of democracy now in Michika local government, because here in this facility we can see changes in the structure. Before, this facility is not like the way you are seeing it, but with the coming of His Excellency on board, he was able to provide a very good structure to show our people that he has health as one of his priorities. And now, looking at the services we are rendering in primary health care, in the previous, our people can only those in the urban area can have access to healthcare service delivery. But now, the people in the remote area, as well as those in the urban setting, they are now having access to the same services. We really appreciate His Excellency for this effort. He was able to make a very concrete structure in every settlement of Michika local government.
So many quality things has been done in this clinic, like many improvements. We have a lot of things that has been changed in the facility. Like this facility before, somebody that visited this facility before will return and will never believe it's the same thing. We have so many services that has been rendered to the clients in this community. Some of the services are free, like ANC labor and delivery, this family planning, and so many things, etc. Issue of program in this facility, we have no problem with it. The development is quite all right, okay? Many things is being done well and it's arranged well. So we thank God for His Excellency for providing some of the things needed in the facility, and we lack no drugs in the facility. By God's grace, everything is okay.
Gaskiya mun samu canji sosai fiye da na da. Muna godewa gwamnati Amadou Umaru Fintiri da Dr. Suleiman. Yanzu mun samu changes kaman services namu da malnutrition yana nan jiyo a community nan. Muna samu yawan muce-mucen yara ya ragu, kuma mutane jiyo suna zuwa yanzu suna jin daɗi, suna samu service nasu free. Kowa ma yana sha'awa ya ga ya zo cikin facility mu domin yanda komai ya zo da sauki. Da asibitin mu nan gaske ba katanga, amma yanzu da ikon Allah ai mana katanga, an gera mana quarters, ai mana sola, ai mana ruwa mai kyau, ba kamar da ana sharo anyhow ana samun cutar cholera.
First of all, I would like to thank our governor for his effort for the prompt payment of our salary monthly without any delay. Secondly, before we were not having drugs in the clinic, but based on the collaboration that he has with the NGOs, we were able to have buy drugs that we have in the clinic. Now we have availability of drugs. Then the next one, before we were not having water in the clinic, we were facing problem with water. Now we have potable water. Even the people that are outside the clinic, they will come into the clinic to come and fetch water freely without any disturbance. And even those that are able to extend the water to their homes, they have extended the water to their homes. Some are still coming to the clinic to come and fetch water in the clinic. And before we are not having, there was no constant light in the clinic. But now we have solar panel in the clinic. We have solar. Every day we have lights in the clinic. And the asthma program, we have the Adamawa State Contributory Management Agency. Monthly, they will send money to our account. Then the people that will be enrolled, the IDPs, they will come to our clinic to come assess their services. Treatment will be given to them free. There's no any payment that they will pay for the treatment. They will come and receive their treatment freely in the clinic without pay any amount, because the government has agreed and has been paying money to our operational account for them. Any person that will come for to the clinic with the plastic, that is the card that is given to those that were captured. So the treatment will be given to them free without any payment of money.
Since this facility was handed over to me on 4th February 2029, by then, no infrastructure. In fact, there is linkage of zinc, no tiling, no boggling, nothing. It is in this regime that we have get improvement, like the one you see now. There is tiling everywhere, there is seat everywhere, drugs available. Even now, it is not up to 1 hour. They bring, I received drugs of 1,723,915 naira just now from Adamawa Essential Drugs. So I'm very happy with this regime.
The transformation of Adamawa State's healthcare system is an opportunity that must be embraced by all. The Adamawa State Primary Healthcare Development Agency encourages the people of Adamawa State to utilize the abundant opportunities available and improve their health and well-being. While challenges may arise, the agency is committed to continuous quality improvement and encourages citizens to provide feedback through the grievance redress mechanisms established at all service delivery points.
So this government, actually, we don't have anything to see. We will only say thank you to the government of Ahmadu Umaru Fintiri for providing our needs and also assisting us in making sure that we have drug revolving fund, that we can be able to pay money, and that we can be able to buy drugs, that we can be able to also have meetings with our WDCs, and also the community now. In fact, the community are accessing their services in a proper way, because they can come to the facility at any time. Most especially those that have the basic healthcare card, their drugs are free by the government. They normally come at any time and they can access their services very well. We are very happy, we are very grateful to this government.
Adamawa State Government, through the State Primary Healthcare Development Agency's motto, is to leave no one behind and nothing untouched. So, if you see something, say something. Together, we can build a healthier and brighter future for Adamawa State.
Really appreciate the government of Adamawa State. We have got so many things that help our clinic or development of the clinic. We have fenced our clinic. Then we have finished our clinic wards, because the community have built wards. So we finish with it with the support of Impact. We complete it. We put bed, mattress, and tiles and paint. So also with this clinic we have got the money and paint the clinic. We bought some drugs, some chairs, we bought machine also, so that we can go for outreach. We have hired some staff that will help us.
From the remarkable efforts in continuous quality improvement to the recognition on a global scale The story of change in Adamawa State serves as an inspiration for other regions through dedication, innovation, and a commitment to the well-being of its citizens. Adamawa State has truly transformed its healthcare system.